Hello, today we will talk about blood supply of the upper limb. Subclavian artery lie on superior surface of body of first rib and on the level of external border of first rib continuous in axillary artery. Axillary artery continuous lateralward and downward. Continuous in axillary fossa on the level of brachium. Artery lie in medial bicipital groove and change name. It will be brachial artery. Axillary fossa have four walls. Anterior wall consists of two muscles, greater pectoral muscle and lesser pectoral muscle. There we have three triangles. Between clavicle and superior border of lesser pectoral muscle, we have clavipectoral triangle. On the level of lesser pectoral muscle, we have pectoral triangle. Between inferior border of lesser pectoral muscle and inferior border of greater pectoral muscle, we have subpectoral triangle. That's why we can divide the axillary artery in three parts. First, on the level of clavipectoral triangle. Second part, on the level of pectoral triangle. And third, on the level of subpectoral triangle. Branch which begins from axillary artery, we will study one by one from different parts. There is axillary artery, which continues on the level of arm in brachial artery. From first part of axillary artery begins superior thoracic artery, arteria thoracica superior, which continues in first and second intercostal space. This artery supplies intercostal muscle in first and second intercostal space, anterior serratus muscle, and partially greater and lesser pectoral muscle. Second small branch have name subscapular artery, which continues in subscapular fossa. This is on anterior or costal surface of scapula, where will supply the same name muscle, subscapular muscle. Third and last branch, which begins from first part of axillary artery, have name thoracoacromial artery. This is short artery which divided in four branches. Pectoral branch continuous to greater and lesser pectoral muscle, will supply them, and give branch to anterior serratus muscle. Next, clavicular branch, which continues to clavicle and subclavius muscle. Next branch have name deltoid. Deltoid branch continues to deltoid muscle. Deltoid branch will supply deltoid muscle and greater pectoral muscle. Acromial branch continues to acromion of scapula, where we'll make anastomosis with the same name branch from suprascapular artery, which begins from system of subclavian artery. Together they will make acromial rete, will supply acromioclavicular joints and shoulder joints. On second part of axillary artery, it's mean on the level of pectoral triangle, begins lateral thoracic artery, arteria thoracica lateralis, which goes downward, lie on lateral surface of musculus serratus anterior, will supply them and give lateral mammary branch, which continues to mammary gland. From third part of axillary artery, it's mean on the level of subpectoral triangle, begins three branch. First, this is subscapular artery, arteria subscapularis, goes vertically downward and divided in two branches, arteria circumflexa, scapula, and thoracodorsal artery. Circumflex scapular artery goes through triangular foramen between musculus teres major, musculus teres minor, and long head of triceps brachii. Continues on dorsal surface of scapula, where we'll make anastomose with infraspinatus branch from suprascapular artery. Together they will supply infraspinatus muscle, scapula, musculus latissimus dorsi, deltoid muscle, lesser and greater teres muscle. Second branch, which begins from subscapular artery. This is thoracodorsal artery, continues vertically downward, lie on lateral border of scapula and continues to inferior angle. This artery will supply musculus latissimus dorsi, teres major muscle, anterior serratus muscle. Next branch, which begins from third part of axillary artery, have name posterior circumflex humeral artery, which goes through quadrangular foramen. This is between teres minor muscle, teres major muscle, long head of triceps brachii, and surgical nick of humerus bone. Artery goes around surgical nick of humerus bone. Make anastomose with anterior circumflex humeral arteries will be last branch from axillary artery. Branch which begins from posterior circumflex humeral artery supply shoulder joints and deltoid muscle and skin around them. Anterior circumflex humeral artery goes around surgical nick but anteriorly and make anastomose with posterior circumflex humeral artery. Also will supply components of shoulder joints. Axillary artery continues downward in brachial artery. Border between them will be on the level of inferior border of greater pectoral muscle. Continues in medial bicipital groove, lie on anterior surface of ulnar joints and on the level of head of radius bone. Brachial artery divided in radial artery and ulnar artery. Give a lot of small muscular branch which will supply anterior and posterior group of muscle of arm. More big branch which begins from brachial artery have named deep brachial artery, which continues on posterior side of arm and lie in canal of radial nerve. Lie between musculus triceps brachii and posterior surface of body of humerus bone. Continues downward. Give muscular branch to posterior group of muscle of arm. This is musculus triceps brachii and musculus anconeus. And on posterior side, divided into main branch, median collateral artery and radial collateral artery. This is two terminal branch from deep brachial artery. Few words about ulnar groove. Between lateral border of olecranon and lateral epicondyle of humerus bone, we have posterior lateral ulnar groove. Between medial border of olecranon and medial epicondyle, we have posterior medial ulnar groove. On anterior surface in cubital fossa, we have two anterior ulnar groove. Anterior lateral ulnar groove, this is between brachial muscle and brachioradial muscle. Anterior medial ulnar groove, this is between musculus brachialis and pronator teres muscle. This is very important because in this four ulnar groove we have ulnar articular rete, which makes by help of four collateral artery, which begins from brachial artery, and four recurrence artery, which begins from radial and ulnar artery. In each of these four ulnar groove, two artery will join. From deep brachial artery, begins radial collateral artery, which continues anteriorly and lie in anterior lateral ulnar groove, where we'll make anastomose with recurrent artery. Middle collateral artery continues on posterior side of arm vertically downward and lie in posterior lateral ulnar groove. Deep brachial artery will supply humerus bone, posterior group of muscle of arm, skin, deltoid muscle, ulnar joints. Next branch, which begins from brachial artery, have name superior ulnar collateral artery, which continues downward on posterior side of arm and lie in posterior medial ulnar groove. We will make anastomose with recurrent artery. Last branch, inferior ulnar collateral artery, which begins in distal 1/3 part of arm and continues downward, lie in anterior medial ulnar groove. Brachial artery will supply all structure on the level of arm, shoulder joints, humerus bone, anterior and posterior group of muscle of arm, skin of arm, and ulnar joints. Brachial artery divided into branches: radial artery, arteria radialis, and ulnar artery, arteria ulnaris. At first we will talk about the radial artery. Artery continues downward, lie between anterior group of muscle of forearm, in the same name canal. Continues downward, in distal part of forearm, radial artery continues on dorsal surface of hand, continues to first intermetacarpal space, go through muscle, and continues on palmar surface of hand. Terminal part of radial artery will make deep palmar arch. First branch, which begins from radial artery, have name radial recurrent artery. Continues upward, anteriorly than ulnar joints, and lie in anterior lateral ulnar groove, where we'll make anastomose with terminal branch of deep brachial artery. This is radial collateral artery. Next branch, which begins from radial artery, have name nutrition artery and muscular branch. Nutrition branch will supply radial bone. Muscular branch will supply muscle of radial part of forearm. Next branch, which begins from radial artery, have name dorsal carpal branch. Dorsal carpal branch joins with the same name branch from ulnar artery. Together they will make, on the level of carpal bone of hand, dorsal carpal rete. Next branch, palmar carpal branch, which continues with the same name branch from ulnar artery. Both make anastomose, which have name palmar carpal rete, on the level of palmar surface of carpal bone of hand. Next, superficial palmar branch, which continues on palmar surface of hand and joins with terminal part of ulnar artery. Together, they will make superficial palmar arch. Next branch, which begins from radial artery, have name first dorsal metacarpal artery, arteria metacarpalis dorsalis prima, which divided in three dorsal digital arteries. One of them lies on radial border of second finger, and two lies on both borders of first finger. On palmar surface, from radial artery begins princeps pollicis artery, which continues to the level of head of first metacarpal bone, where we'll divide it into proprial palmar digital artery, which lie on both borders of first finger on palmar surface. Next branch, radial indicis artery, arteria radialis indicis, which continues in first intermetacarpal space, and after that lie on radial border of index. This is second finger, and will supply this region of second finger. Superficial palmar branch which begins from radial artery, joins with terminal part of ulnar artery and closed superficial palmar arch. Terminal part of radial artery joins with deep palmar branch from ulnar artery and closed deep palmar arch. Ulnar artery begins from brachial artery on the level of head of radial bone and continues downward between anterior group of muscle of forearm, lie in the same name sulcus, and continues downward together with ulnar nerve. Continues on palmar surface of hand, where terminal branch of ulnar artery will make superficial palmar arch. Give a lot of branch. First of all, we have two ulnar recurrent artery, anterior ulnar recurrent artery and posterior. Anterior continues upward, lie in anterior medial ulnar groove, where we'll make anastomose with inferior ulnar collateral artery. Posterior ulnar recurrent artery continues posteriorly in posterior medial ulnar groove, where we'll make anastomose with superior ulnar collateral artery. Next branch have named common interosseous artery, which have 1.5 cm long, divided in anterior interosseous artery and posterior interosseous artery. Anterior lie on anterior surface of interosseous membrane, give nutrition branch to radial bone and ulnar bone, give a lot of muscular branch to deep muscle of anterior group of forearm, and continues in distal 1/3 part of forearm, goes through foramen in interosseous membrane, and continues on dorsal surface of forearm. Terminal portion of this artery will make anastomose with dorsal carpal branch and make dorsal carpal rete. Posterior interosseous artery go through foramen in interosseous membrane in proximal 1/3 part of forearm and lie on posterior side of interosseous membrane. From posterior interosseous artery begins recurrent interosseous branch, which continues upward on posterior side of ulnar joints and lie in posterior lateral ulnar groove, where we'll make anastomose with middle collateral artery. We have 8 arteries, 4 recurrent and 4 collateral arteries, joined together and make cubital articular rete. Will supply all components of ulnar joints, muscle and skin. Posterior interosseous artery continues downward on posterior side of interosseous membrane, give nutrition branch to ulnar and radial bone and muscular branch to muscle of posterior group of forearm. Terminal branch will join with dorsal carpal branch and make dorsal carpal rete. On the level of carpal bone from ulnar artery begins dorsal carpal branch, which joins with the same name branch from radial artery and make dorsal carpal rete. On palmar surface begins palmar carpal branch, which joins with the same name branch from radial artery and make palmar carpal rete. A last branch which begins from ulnar artery have named deep palmar branch, which joins with terminal part of radial artery and closed deep palmar arch. Terminal part of ulnar artery joins with superficial palmar branch from radial artery and closed superficial palmar arch. Articular cubital rete. Rete articulare cubiti. We have 4 collateral artery and 4 recurrent artery. On the level of anterior lateral ulnar groove, we have anastomose between radial collateral artery, which begins from deep brachial artery, and radial recurrent artery, which begins from radial artery. In posterior lateral ulnar groove, we have anastomose between middle collateral artery, which begins from deep brachial artery, and recurrent interosseous artery, which begins from posterior interosseous artery. This is branch from common interosseous artery from ulnar artery. In anterior medial ulnar groove, we have an anastomose between inferior ulnar collateral artery, which begins from brachial artery, and anterior ulnar recurrent artery, which begins from ulnar artery. In posterior medial ulnar groove, we have an anastomose between superior ulnar collateral artery, which begins from brachial, and posterior ulnar recurrent artery, which begins from ulnar artery. Together, 8 arteries will supply ulnar joints, skin, and muscle on the level of cubital fossa and ulnar joints. On dorsal surface of hand, on the level of carpal bone, we have dorsal carpal rete. This anastomose makes by help of dorsal carpal branch, which begins from radial artery, and dorsal carpal branch, which begins from ulnar artery. Terminal branch from anterior and posterior interosseous artery also continues and joined in dorsal carpal rete. From dorsal carpal rete begins more often 4 dorsal metacarpal artery. First of them lie in second intermetacarpal space, second continues in third intermetacarpal space, third lie in fourth intermetacarpal space, and last, fourth lie on ulnar border of hand, on the level of head of metacarpal bones. Dorsal metacarpal artery divided into dorsal digital artery. Only last continues in dorsal digital artery. That's why we have 4 dorsal metacarpal artery and 7 dorsal digital artery, which continues on ulnar border of second finger, on both border of third, fourth, and fifth finger. Don't forget that from radial artery begins first dorsal metacarpal artery, which divided in 3 dorsal digital artery and supply radial border of second finger and both border of first finger. This artery will supply bones, joints, ligaments, skin, interosseous muscle. On palmar surface we have palmar carpal rete, which makes by help of palmar carpal branch from radial and the same name branch from ulnar artery. Will supply radial carpal joints, muscle, ligaments, skin on the level of radiocarpal joints and carpal bones. Next, this is deep palmar arch, arcus palmaris profundus, which makes by help of deep palmar branch from ulnar artery and terminal part of radial artery. Lie on the level of base of metacarpal bone, will supply metacarpal bone, umbilicalis muscle, interosseous muscle. From deep palmar arch begins more often 3 palmar metacarpal artery, which continues on the level of second, third, and fourth metacarpal bone, supply dorsal and palmar interosseous muscle, continues to the level of head of metacarpal bone, and joins with branch from superficial palmar arch. Next, superficial palmar arch, which makes by help of superficial palmar branch from radial artery and terminal part of ulnar artery. Lie on the level of body of metacarpal bone. From superficial palmar arch begins more often 4 common palmar digital artery. 1, 2, 3, 4. Continues to the level of head of metacarpal bone, where will divide it into proprial palmar digital artery. Only last fourth common palmar digital artery continues in brachial palmar digital artery. That's why we have 4 common and 7 brachial palmar digital artery, which continues on ulnar border of second finger and both border of third, fourth, and fifth finger. As you remember, from radial artery begins princeps pollicis artery, which divided into brachial palmar digital artery, which supplied first finger on palmar surface, and radial indicis artery, which lie on radial border of second finger on palmar surface of hand. Together they will supply bones, muscle, joints, ligaments, all structure of hand.